I see so many people coming in. Thank you so much for joining us. We are going to start in just a minute. Right. I think we have quite a bit of us on this morning. I'm going to say that it's 9:04. And in the interest of time, I want us to get started so that we can get through our program and have enough time for questions and answers. So good morning, everyone, and welcome. Welcome to the Southside Healthy Community Organization's Town Hall discussion. Thank you so much for joining us. I am happy to see, as I look around here, so many familiar and new faces this morning as we talk about building healthier lives on the South Side of Chicago. And so my name is Kimberly Hobson, and I serve as the CEO of the Southside Healthy Community Organization, or the SSHCO, which we fondly call it. I recently celebrated my one-year anniversary, which is hard to believe, as Chief Executive Officer of this amazing nonprofit organization. And as you know, we're striving to help the Southside residents live healthier lives. And I continue to be excited about our work and our coming together to share these updates on a quarterly basis. And so we may have new people in the audience. So each time we have a town hall, I do like to remind everyone of who we are and why this matters to us and certainly to you. And so the Southside Healthy Community Organization is a nonprofit organization, and it's actually made possible through the funding from the state of Illinois' Healthcare Transformation Initiative. And we are actually comprised of 13 healthcare organizations and partners on the South Side of Chicago, and that includes 3 hospital systems. We have 4 safety net hospitals and 6 federally qualified health centers. So the SSHCO was actually formed to put an urgent and sustainable focus on improving health outcomes on the South Side by expanding access to care, connecting patients to social services, and also supporting residents along the way through care coordination. And, you know, as we move forward, we'll reach these goals by implementing this healthy community model that you see before you. So as you can see on this slide, is that there are 4 components of this model. And we believe that when combined, these 4 components all together will help us to help patients achieve better health. And so as we implement this model, we aim to improve health on the South Side by adding primary care providers and maternal health specialists to our network. We also plan to increase access to behavioral health providers, creating a connected care technology platform for all 13 of our partners, and deploying a direct care team model to help our patients navigate and access all of the care options that they have. Our overall aim is to help people live their healthiest lives. And so at our last town hall meeting in March, it was announced that we awarded $1 million in grants to community resources or community-based organizations, which provide free services that support good health for things like nutritious food and housing and employment training and support and emergency financial services and transportation to and from medical appointments, making it easier for our residents to see their doctors and ensure that they're managing their care. And so I am very pleased to share that those services are up and running, and over 300 connections have been made to community resources for residents and patients on the South Side. And so you'll hear more about that later in this town hall. Now, if we think back to March again, we also shared the start of a process to recruit and activate a community advisory council. And from the very beginning, as the 13 partners initially came together around this important healthcare transformation project on the South Side, community input was, and it continues to be, in the front and center of the work that we do. And so we continue to get this input and ideas and advice from the community, and it has driven the SSHCO's work from the very start. And so you'll meet our new Community Advisory Council members today via photos and brief descriptions, but you'll also hear from a couple of them virtually about why they stepped up to volunteer their time and support for this important effort and to serve the South Side. And so we have plenty of time for questions once we've done with all of our presentations. And so Q&A will follow. And then we will be sure to put your questions in the chat directly to everyone. And we will do our best to answer as many as we can in the last 20 to 30 minutes of the town hall. And with that, I'm going to turn this over to Sarah Janvier, who is our Chief Operating Officer. And Sarah will be walking us through how a resident or a patient enrolls in the SSHCO and the key benefits of enrollment. And so once again, thank you all so very much for being here this morning. And I will now turn it over to Sarah.
Thank you, Kimberly. Good morning, everyone. Thank you for joining us this morning. As Kimberly stated, my name is Sarah Janvier. I serve as the Chief Operating Officer for the SSHCO. I have the pleasure of helping to lead our care coordination team. So I'm very excited to talk to each of you this morning about our care coordination model. The goal of our care coordination model is to help to address social determinants of health for our patient population, helping to address those non-clinical needs that prevent clinical stabilization, as well as helping the patient to navigate to relevant social services for long-term support. As we know, over 80% of a patient's health is not related specifically to clinical care, but those social determinants of health. So it's very important that our team continues to connect those patients to those services. The other primary goal of our program is to drive chronic disease self-management. So we have a team of nurses as well as community healthcare workers that help to support patients in achieving personal goals and leading to improved outcome around those chronic diseases, as well as helping to drive engagement with our healthcare system and navigating them through clinical appointments. And to Kimberly's previous point, ensuring that they also have transportation to those appointments as well. Our target population for our care coordination program is patients that have unmet clinical and social needs, as well as under and uninsured patients that live within our SSHCO zip codes or have a medical home within our zip codes. Next slide, please. Currently, our patients are entering our care coordination services either through emergency departments where we have team members deployed and physically present amongst our 13 collaborative partners, or through a medical home that they've been assigned to, and they've been identified as a patient that is in need of care coordination services, as well as community outreach. So as we table or we're out engaging community members from a grassroots perspective and identify individuals that would be in need of care coordination services, we also have the opportunity to enroll them in those services as well. Once a patient agrees to enroll in our program, they're then assigned to a care coordinator, which can be a community healthcare worker or can be a nurse or LPN that helps to service them in navigating them through the system and helping them to improve those chronic disease conditions. That care coordinator then connects them to the services that they need, whether it may be social services or getting them engaged in a clinical appointment with one of our medical home partners. Once that appointment is scheduled for that particular need, our team members make it a priority to physically be present for that patient in that initial appointment, to engage them and answer questions, and also to really focus on fostering that trust in relationship with that patient and helping to serve as the advocate for them. Once that patient has worked with their clinical team to develop a care plan, our team partners with that clinical care team to ensure that we're helping to manage expectations around the clinical care plan, and we're aligned in helping to improve the same outcomes. We then, based on that clinical care plan, discern how often we intersect with that patient. For someone that has a newly diagnosed condition or a condition that is currently unmanaged, we might speak to them a lot more frequently than someone that is working to get a condition under control over the past couple of months. And that might be through phone interaction or in-person interaction. But those are discussions that our care coordinators have with our patients to discern what is most feasible for that patient, and then how frequently we should be intersecting with them. And that process continues on until we're able to meet the goals that we've outlined with the patient and the care team, as well as it's dependent on the social needs that that patient may have. Next slide, please. To date, our great care coordination team has screened over 3,000 Southside residents. And of those residents, the ones that were eligible and have agreed to enroll in our care coordination services, we've been able to enroll over 800 patients into our care coordination services. For what we've seen with that patient population, the most common age range is 25 to 34. So we're really working with our communications team and our care coordination team to really understand how we tailor communication specific to that particular age population to ensure that we're engaging them in the most effective way. The most common diagnosis that we've seen for the patient population thus far has been behavioral health conditions, hypertension, as well as diabetes. So we're now working to discern how do we build programming specific to those disease conditions. So not only are we connecting them to care, but we're also connecting them to very specific and tailored programming to help them through that process. As Kimberly stated, through our grantees as well as other community-based organizations, we've been able to successfully complete over 300 referrals to social services around housing and shelter, emergency financial support, employment assistance, food assistance, as well as transportation to those healthcare services that we're connecting them to, as well as patients that are being discharged from the hospital emergency department. And we've gotten a lot of positive feedback on all of our partners and all the services we've been able to provide our patients. Thank you. And we will be handing it off to Marilyn to talk about our CAC programming.
Yes, Sarah. Good morning, everyone. I am thrilled to announce that we have an established and already active Community Advisory Council. Next slide, please. Let me give you a little background. This is how it all came together. A call for candidates was put out very broadly throughout the South Side of Chicago in late March and with an early April deadline. We received 65 applications that came in from for only 15 open spots. And this, again, was an excellent response to our request. Applicants came from 10 of our 15 zip code areas, and the candidates were carefully reviewed by an internal SSHCO committee. And the recommended 15 were approved by the SSHCO Board of Directors. The Community Advisory Council will provide regular input to the SSHCO on issues of interest to the broader community. It will maintain the important voice of the community that has driven our work from the very start. The council brings a variety of lived experiences, including business, faith-based, advocacy, public health, healthcare, social services, and much more. An orientation for this council was held on June 2nd, and the council has already began some amazing work to prepare for upcoming work groups and prioritizing various initiatives. So today we are very excited to introduce our advisory council to you today. Our first member is Dylan Adazi, William Chamberlain, Candace Draw, Maya Gamble, Bernetta Heron, James Thompson, Andrew King, Laura My Sweet, Miriam Muhammad, Gabrielle Myers, Olivia Ndayabaje, Samin Kadir, Charles Rogers, Teresa Vadilon, Quinn Taylor, and there's Dr. Chamberlain at the end. So to begin, I know that you are as excited as we are to hear about what's going on about the council. So I would like to introduce one of our council members, Quinn Taylor, to get us started. Quinn, good morning. How are you?
Good morning. Great to
I'd
be
like
here.
to thank you, and thank you for joining us today, Quinn. Quinn, we would like to find out what prompted you to want to be involved with the SSHCO?
Certainly. Well, I'm born and raised on the South Side. I am a proud Chatham kid. We know that diversity, equity, and inclusivity is an important discussion right now, and the need for the need to improve health literacy is more important than ever. More dialysis centers are popping up in our community, and more Black Americans are crashing into dialysis than ever before. Black Americans are 4 times more likely to be diagnosed with chronic kidney disease compared to white Americans, because we are disproportionately impacted by diabetes and hypertension, which are the 2 leading causes. Prevention, education, and empowerment is part of the foundation of the National Kidney Foundation of Illinois. And so I want to bring that in this space, and also more importantly to the people who live in the community.
And thank you. It's such a value to have you join us, and we're looking forward to the amazing work and contributions you can bring to the council. Thank you again. Our next council member is Dr. William Chamberlain. Dr. Chamberlain, good morning. And
Good morning.
Good morning. We'd like to find out from you, Doctor, why did you apply and want to volunteer your time on the Community Advisory Council?
Thank you, Marilyn, for the introduction. Good morning, and it's a pleasure to be here this morning. I'm particularly excited by the potential for community health workers and nursing personnel to improve relationships and communication between the medical community and people here on the South Side. As a healthcare profession, we have a lot to offer to treat diseases like hypertension and diabetes, but we have to identify those people. Hypertension affects nearly 50% of our population, and yet many go undetected and untreated. It's exciting to see the work that's being done to identify those patients and get them into therapy. So I'm very excited by the opportunity we have to bring an effective organization to the South Side to address these problems. Thank you.
Thank you, Dr. Chamberlain. Thank you, Quinn Taylor. And again, thank you both. Many thanks to our Community Advisory Council members. You will be seeing more of them. Again, they're doing some amazing work, and we're thanking them so much for their service, not just to the community, but to the Southside Healthy Community Organization. We're looking forward to the ongoing input and the dialogue among the council and its communities. So thank you. And now I'm going to turn it back over to Debbie.
Thank you so much, Marilyn. Good morning. I'm so happy to be with all of you this morning. My name is Debbie Gonzalez. I'm the Chief Patient Experience Officer with Friend Health Center, which is a federally qualified health center and proud member of the SSHCO network. Friend, as a proud partner organization of the SSHCO, provides integrated health services at 5 locations on the south side of Chicago. And as a member, and through the support that we get through the SSHCO, we are able to increase access to care, reduce wait time for appointments, and improve health outcomes. Through the Community Health Worker Program and care coordinations, as we've heard already this morning, patients and families are connected to needed support and resources. So now we want to take a couple minutes and hear from you. We're going to put you to work this morning. I have 3 poll questions. You're going to see them come up on your screen, and choose the best answer that applies. You may see more than one answer that you could choose, but choose the one that most represents your answer. And then I'll share a little bit as the as the poll numbers come in about how we're seeing the answers go. So the first question, who do you go to for information about your health care? So far about 65% of you are saying doctor. Yeah, that's probably about, and then online resources is probably the number 2. It's about 75% are saying doctor. And online resources, and then nursing and pharmacists. So that's kind of the answers we are seeing. And we have another poll question that's going to be coming up. Okay, here's the second poll question. Same thing, choose the one that makes the best answer for you. Where specifically do you go for your health care? And for the most part, it's pretty similar to the first question. Have a doctor and primary care provider. Actually, that's a runaway. That's about 99% of you are answering that. And then clinic or urgent care, some pharmacy. Yeah, so about 88% of you have said doctor or primary care provider for the second question. So we're going to have one more poll question that pops up. Thank you so much for participating in this. This really helps us. How do you like to receive information about community and health resources? So it looks like email, social media. Email in particular is pretty high. About 78% of you are saying email so far. And then social media, that makes sense. I think that's probably what we expected to see. And again, don't forget, you can still put your questions in the chat. Okay. Yeah, about 73% email, and then about 15% social media. So that pretty much rounds everything out. And I think we have 2 more questions that are going to come up. And for these questions, you can just type your answer in the chat. So what is one thing that you wish you had better access in terms of your own health? And again, these questions are really helpful to the SSHCO and direction and enhancements that are going to be made. And these will be looked at well beyond this town hall. So we really appreciate your input. You could, again, just type your answer in the chat. Given a few minutes that you had to type and not check a box. These are some great questions coming in. A lot around availability, appointments, timely appointments, pharmacy. I'm seeing some gym access, which is great. That's I think we're seeing more and more resources devoted to gym and exercise. So that's great. Metal dental care, wellness community events, that's also great. These are just some really great input. Nutrition, I need that. Affordable and access for resources, absolutely. Mental health resources, I've seen quite a few come in for mental health support for children and adults, for sure. I think we're going to have one more question that comes up. There it is. This is really important. As you heard about the Community Advisory Council today, what are the first topics that the Community Advisory Council should prioritize? This is going to be very important for that group as well as the SSHCO and leadership to, we know there's a lot of things that we want to accomplish, but what's most important to all of you for them to work on and prioritize? Violence prevention, absolutely. Mental health, housing. Yeah, I'm seeing quite a bit of mental health support and housing, food insecurity, absolutely. Incarcerated women and moms, that's really important for women as well as men. Interoperability of services, what a great comment. Teen wellness. These are wonderful responses. And I know that the council is going to be thrilled to see all of these, and it's going to help guide them. Still seeing some of it. Cross collaboration between entities and support services, absolutely. Patient education. And for sure, we need to make that simple, right? Easy to understand, easy accessible information. Substance abuse, I have seen a few coming in about that for sure. Very important. Well, thank you so much for putting all of that great information and your thoughts into the chat. And I think, let's see what we're gonna, I think, Cassie, we're gonna go to some of the questions coming into the chat, and I'm gonna ask our wonderful team to provide some answers. So one of the questions, does this cover transport from Advocate South Suburban Hospital, zip code 60429 in Hazel Crest? Would it cover Southside residents? Sarah, I was wondering if you could respond to that.
Thank you, Debbie. Currently, we have 15 zip codes that we're predominantly focused on servicing. If we do have a patient that is within our medical homes, within our zip codes that need transportation beyond the zip codes that we're servicing, we can accommodate that. But in our current state, that zip code in the Hazel Crest area does not fall into scope.
Okay. I think the next question I'm gonna ask to Sarah as well. How can I assist with transportation for the Southside Healthy Community Organization? What is the process?
We are often taking inquiries from community-based organizations on how we can service such a large population. So we do have an info email address that information can be sent to around assisting with specific social resources. I think that's the first entry point. And the team, if we could share that information email around at the end of this town hall with the attendees, so they're aware of who they can contact related to that, that would be helpful. And if you're specifically referencing wanting for us to provide transportation services, that point of email contact is also the best location for us to ensure that we're getting those referrals and processing them in a timely fashion.
Thanks, Sarah. So the next question, how can the partners refer clients to the SSHCO? I'm going to ask our CEO, Kimberly, if she would respond to that.
Yeah, I'm going to respond to that, and then if others want to, if Sarah, if you want to jump in, you can. In terms of our partners, so when you talk about our partners, I think about the 13 healthcare organizations that we talked about. And so if we're talking about those healthcare organizations, our care coordination staff is in many of those. At least 6 of those are partner sites. And so that's where the connection would happen at that particular place. If there are other partner organizations, then they can contact the partner organizations know how to contact our care coordination team so that they can refer a patient. Now, I also want to talk about if we're talking about how can other organizations that are not sitting on our board or what have you, our actual formal partners, then what we would do is we would ask you to go to our website at www.southsidehealthycommunity.com, and there are forms that can be filled out for to refer patients in. And if you have questions, you can leave questions there as well. But this brings up something that additional that I'd like to address that's not necessarily in this question, but that is, will there be at some point a phone number that people will be able to call? And so we do not have all the resources for a phone number as of right now, but that is certainly something that is on our bucket list to be able to develop a phone number and have a way for residents and organizations to contact us by phone. That is on our list of things to do. So I just wanted to address that as well.
Thank you so much, Kimberly. We appreciate that. Just as a reminder, we want to let everyone know you can continue to put your questions in the chat. Even if we don't get to all of them today, they will be answered and you will get responses to those. So continue to go ahead. We still have good time today, but continue to put them in the chat. Okay, we'll move on to the next question. Are there no residents as part of this council? Marilyn, I thought maybe you could address that.
Certainly. All of the members that sit on our council, they live and or work in our zip code areas. To date, there isn't anyone on the council that is not a part of those zip codes.
That's great, Marilyn. Thank you so much. The next question, is there an initiative in motion for patients encountered and enrolled into the SSHCO with housing concerns who have no form of communication, such as a cell phone, home phone, email, or trusted relative? Sarah, I thought maybe you could respond to this one. It's a great question.
Yeah, it's a wonderful question and one that is timely. This is a concern that's often raised with our patient population, especially our transient patient population, and our care coordination team often work to receive that information, that contact information from.
I think Sarah might be having a little bit of a technical glitch. She might just be a little bit frozen. So we can always go back to that because I know it's an important question. So we'll let her get back connected. I'm going to read the next question. I am Baratang from Rhode Island. I attended just to listen and learn. Thank you for joining. I have an unforeseen circumstance and needed to leave. May I have access to these slides for reference? Kimberly, I thought maybe you could respond to that.
Yeah, I'm not quite sure, to be honest, if we post these slides afterwards, but I certainly don't see why we cannot. So I do think that what we can do is Mary and Peggy, we can make note of this question, of this individual, and we can get those slides out. This information is definitely public, and we'd be certainly happy to share.
That sounds great. That sounds great. I'm sure everyone will appreciate that and probably refer to them later. Okay, next question. I would love to assist, especially as a postpartum doula. Oh my gosh, we definitely need you. I am also a resident. How can I help? Marilyn?
Hi, I would like to take down your information and I will be happy to put you in connection with one of our Community Advisory Council members to answer that particular question. We do have some resources and members of the council who can assist with that. So thank you for your question. Kimberly,
I'd
did
like
you
to
have
have,
something to
yeah, I
add?
have a little follow-up with that too. We do have a maternal health model that we're going to be executing on and rolling out in the fall. And so we'll keep track of this individual just in case they're interested in assisting in that way and see how they can get involved from a maternal health perspective, our model that we'll be rolling out. So we'll do that as well.
Thanks, Kimberly. Thanks so much. And Marilyn. Okay, next question. How or is NowPow services being used for care coordination? I'm not sure if Sarah was able to come back on, but Kimberly, if you wanted to
Yeah.
answer, sure. Oh, there's Sarah.
Sarah, can you? Yeah, she's back. I was going to take it, but she can take it. Yes.
Okay,
Apologies, I've been having some challenges with technology this morning.
no worries.
So as it relates to NowPow services, NowPow, I believe a couple of months ago or about over a year ago was acquired by a larger organization called Unitas, and we are working with Unitas as a CBO referral platform to ensure that we're getting our patients access to the resources that each of them need, in addition to the other grantees that we talked about earlier.
That's great, Sarah. Thank you. Not sure if we have any more questions that are popping up in the chat.
We do. One
Okay.
second.
Okay, Kathy, no, that's okay. We have a lot of folks behind the scenes here making this all work. I get to just sit here and read the questions. And again, you can keep posting the questions in the chat. It's, we'll try to get to as many as we can, but we will get to them even after the town hall is complete. So keep them coming.
Yeah, I do think that someone is asking that we go back to the question that Sarah, you went offline, if you recall that question.
Oh.
A question around the phone communication component.
Yes.
Yes. So we have encountered several instances where we have patients within the transient population that we currently are partnering with them to either use a relative point of contact for that communication, but we are starting to look into alternatives as it relates to being able to connect them to some sort of cell phone services through either another community-based organization or looking internally if we can help to resolve that issue as it's coming up more and more with our population.
That's great, Sarah. Thank you. I know that was an important question. Thanks, Kimberly, for bringing us back to that. Mm-hmm. The next question that we have, how can we share information about organizations that provide some of the services respondents have identified as needing, specifically mental health, nutrition, holistic events, non-Western modalities? Kimberly, I thought maybe you could take that one.
Yeah, I think, thank you so much for bringing that up. I think that we will continue to say, given that we do not currently have a phone number, I am going to ask that you go to our website. There is certainly an area there where you can put this information. And quite honestly, we do get lots of feedback online with people giving us community-based organization resources that they'd like for us to connect. So I'm going to ask that you go to www.southsidehealthycommunity.com and put any requests that you have there, and we will certainly be able to follow up. We want to make sure that we build our resource list so that we can make sure we're getting patients out to the community-based resources that they need to improve their health.
That's great. That's great, Kimberly. Thank you. And I think we're going to have some more questions that are going to come up. What are the zip code servicing area? Sarah, I thought maybe you could take this one. You probably know this by heart.
Uh, Thank you, and it's a great question. We can send this out via email to all the participants, a map that outlines all the zip codes that we service. It's about 15 zip codes across the south side of Chicago that have a population of about 900,000 residents. So we can send that map out to ensure each of you have access to that map in the area that we serve. And again, that is our predominant focus. We do have a transient population, as mentioned before. So there are some of our patients that are enrolled that might not live specifically in the zip code, but their primary care physician office or where they receive their medical cares within that zip code. So we also take into account those patients as well. But the bulk of our patients fall into those 15 zip codes that we'll send out to this group.
And I'd just like to add that those 15 zip codes are the 15 zip codes that the city of Chicago outlines as the South Side of Chicago. And so these aren't zip codes that we just, pulled out of a hat. These are the zip codes that the city considers the South Side.
That's great. That's great. I know that question has come up a few times in the chat, so we wanted to make sure that we were able to answer that. Thanks, Sarah. Next question. Can you please share information if you have new career opportunities that you are recruiting for? Also, do you have internships in working with students in MHA programs seeking internship opportunities? Kimberly, or maybe even Sarah may want to weigh in on this.
Yeah, I'm going to start with this one and say that we do not have a formal internship program, but that certainly piques my interest, and we'll make sure that we keep note of that. Now, in terms of hiring, we are actively hiring community health workers into the Southside Healthy Community Organization. Quite honestly, we have a dire need to hire community health workers. And so, again, if you have individuals that are interested. And I think if we have someone on this call, I think Stephanie may be on the call. I don't know if we can plug her in, but perhaps, Sarah, you may be able to address this. Perhaps we can tell individuals how to get in touch with us if they have individuals that they would like to inform about these job opportunities. I also think that we should send something out to all of the participants here today and to our continue to do this in our listserv so that we can make sure that we get as many applicants as we can, because we are looking to hire over 50 community health workers by the end of the year.
Yeah, to Kimberly's point, we are currently recruiting for community healthcare workers, nurses as it relates to RN, as well as LPN positions. Those positions are posted on our website, and individuals be able to click that link. If there are organizations that are interested, particularly in us partnering with them around that recruitment or having our team members come out and speak to a group of individuals, we are more than willing to do so. And we do plan on or intend on sending out communication as it relates to those open positions. And we're really focused on recruiting individuals that live within our community. It's very important for us to ensure that we have individuals that understand the needs of this particular population and connect and build that trust with our patients. So if you do have individuals that you love to send our way, please do so.
Thank you both. Thanks, Kimberly and Sarah. That's great information. We did have a few questions in the chat about that, about hiring and opportunities. Next question: what is the best way for an organization that can support the goals of the SSHCO to provide partnership, approaching with an integrated mental health focus? Sarah, could you maybe take that one?
Great question. Mental health is one of our primary pillars of focus, especially knowing the need that's been identified on the south side of Chicago. We recently launched a psychiatry program with one of our partners where we're hoping to expand access for those services across the south side of Chicago. If we do have organizations that are interested in partnering with us or helping to better understand how they can help service our patient population. Again, I'm going to redirect you to the website. There is a questionnaire that can be populated around just sharing feedback or questions related how you can continue to partner with us. So that is the best point of contact, and we have a team that ensures that communication gets over to the right person, so we can ensure timely follow-up.
That's great, Sarah. Thank you. I think we're going to have a few more questions that come up. We've got a few more minutes left that we can respond to questions in the chat. Again, you can keep putting them in there. We will respond even after the town hall. So continue to put your questions in the chat. How are faith-based institutions being used to help coordinate these services? Marilyn, what a great question. I'm going to ask you to respond.
Thank you. I may need a little help on this, but we do have a few faith-based institutions that are a part of our network. And we also have a couple of members serving on the Community Advisory Council that are faith-based. Kimberly, Sarah, is there anything else you'd like to add, please?
Yeah, faith-based institutions are certainly a part of the outreach work that we have done in the past and that we will continue to do. So we do have one pastor on our Community Advisory Council, but faith-based organizations in terms of getting information out into the community, we have an effort actually that we will be continuing to work with faith-based institutions around these jobs that we have available and getting information out to these organizations to be able, to these churches and so forth, to be able to spread the word so that we will have the resources come in, and we will potentially, have some individuals that'll come to us that way. So faith-based institutions is certainly a part of our strategy in terms of outreach, the outreach work that we do.
Thanks, Kimberly, and thanks, Marilyn, for your response. Important information for sure. Next question, would it be possible to incorporate community health workers into research? Kimberly, did you want to take that one?
Yeah, I'll take that. We are currently, that's definitely not something that's out of the realm of possibility. That is not our focus currently at this time. We have some specific goals and so forth that we are aiming to reach as it relates to our proposal to the state and our goals and requirements from the state, but certainly not something that we couldn't look at down the road and certainly at the appropriate time.
That sounds great. That sounds great. Thank you. Taking a few minutes here. I think we've got a few minutes left to answer a few more questions live.
This is Marilyn. I'd like to add, sure. Lisa Cox is on the line. I'm not sure if she could be able to be unmuted.
Yeah, she's real. I don't think, I think she's not able to unmute probably. So we
wanted to just make sure the person that had the maternal question that we have a work group working on that. So if they have any questions, please feel free to reach out to us and we'll be happy to assist with that question.
Good.
Thank you.
Thanks, Marilyn. Okay, next question. Good question too. Do you have to be a qualified patient to receive transportation benefits if you live on the south side? Sarah, did you want to answer that?
Sure. So in our current state, transportation benefits are offered to patients that are enrolled in the care coordination services, as well as patients that are enrolled in some of our clinical care programming, like our telepsychiatry program. And as we move forward with launching our maternal health program, those transportation services will be available to those patients. we do intend on looking on how to expand those transportation services to our partner organizations. So if our partner organizations among the 13 entities has a patient that is in need of transportation services, those patients would also be eligible for transportation services. But in our current state, those are the individuals that qualify for transportation.
Okay, Sarah, thank you. So the next question, does the SSHCO have a central online location for partner organizations to highlight community-focused events aligned with SSHCO values and priorities for Southside residents? Sarah, did you want to answer that one?
Sure. In our current state, we do not have that information highlighted on our website. It is something that we've discussed on several occasions because it is important to us to highlight the great resources that are available within our community. And it is something that we've started work on discerning how do we create a resource guide and toolkit in a sense for an individual to be able to use our website and platform to serve as a centralized repository as to where are those resources on the south side of Chicago, because we know there's great work that's being done already within our community, and it's very important for us to highlight the great work that's being done and ensure our patients are, not only our patients, but our community has access to that information.
That's great. And certainly all of the feedback that we get today just helps, drive all these enhancements. So I'm going to take one more question here. This will be the last question before we wrap up. But again, we will respond to all the questions that were posed in the chat that we may not have gotten to. You still have a couple minutes to put them in. Is all the funding from the state? Are there any plans to work towards getting private funding sources? Kimberly, did you want to take that one?
Yes, I'll take that one. So currently, the vast majority of the funding is from the state. And so that's how this organization became about. From funding from the state of Illinois over a 5-year period, we have been funded. We are looking at a sustainability plan and how we continue to sustain ourselves once that initial funding is over. There could be additional funding from the state as well. We also currently, we do have some private funding from a couple of foundations that have funded us for certain projects. And we are certainly continuing to build those relationships as many organizations and foundations are interested in the work that we do. And so right now, the vast majority is from the state, but we do have 2 organizations that have funded us from a private foundation perspective, and that will continue over time.
That's great. That's great. Wow, we had such great questions and information. That's all the time that we have this morning to respond to all of those live, but you'll hear from us after the holidays with answers to the questions that came up this morning that we weren't able to answer live. I'm going to turn it over to Kimberly so that she could do a quick wrap up.
Thank you so much, Debbie, and thank you for serving in this role. I appreciate everyone and thank everyone for being here and for sharing so many thoughts, so many questions. Your questions are critically important to us because it helps us to continue to feed the work that we do and inform the work that we do. So please stay updated on the SSHC by visiting our website, as I've mentioned several times, and joining and liking our social media channels and continuing to attend our quarterly town halls. And most importantly, if you know someone without insurance or on Medicaid who could benefit from the SSHCO services, please send them to our website to fill out a brief form, and one of the community health workers will reach out to them to connect. And so once again, thank you. Have a great day and have a wonderful 4th of July weekend. Thank you.